the cell's outer wall, where the phospholipids lie, comes a signal of damage, a cellular cry. Phospholipase A2 wakes from its sleep to harvest arachidonic acid for the pathway to keep. It meets two enzymes, COX-1 and COX-2, waiting to build something painful and new. From this fatty precursor, they catalyze the start of prostanoids that play a vital inflammatory part. Oh, they block the cyclooxygenase line to keep those prostaglandins from acting so fine. No more PGE2 to sensitize the nerve. That's the analgesic action patients deserve. From swelling to fever, they bring the heat down. The most famous analgesics in every town. Now COX-1 is constitutive, a housekeeper by trade, protecting the stomach where the mucus is made. It helps the blood clot with thromboxane A2 and keeps renal blood flowing for me and for you. But COX-2 is induced when the cytokines flare, bringing pain and inflammation into the air. Most NSAIDs are non-selective and block both the same, while celecoxib targets just the COX-2 flame. And there's aspirin and elder with a special trait. It irreversibly acetylates to seal COX's fate. By grabbing a serine residue right at the site, it knocks out the enzyme with all of its might. In low doses it stops platelets from clumping together, protecting the heart through the stormiest weather. But don't give it to kids with a virus or flu or race syndrome, might bring a liver crisis to you. But this story has shadows, a cost for the piece as the PGI2 and protective signal sees. The stomach gets raw as the acid levels climb, leading to GI bleeding and ulcers over time. The kidneys may struggle as their vessels go tight, retaining the sodium and water in a renal fight. And if you have asthma, watch the leukotriene shift. Blocking the COX gives the LOX pathway a lift. In the background stands Paracetamol, a different kind of guest. It's an analgesic and antipyretic, but fails the inflammation test. It works in the brain in the central domain to reset the thermostat and quiet the pain. It spares the stomach and the platelets flow, but too much can make the liver's glutation go low. They block the cyclooxygenase line to keep those prostaglandins from acting so fine. No more PGE2 to sensitize the nerve. That's the analgesic action patients deserve. From swelling to fever, they bring the heat down. The most famous analgesics in every town. So remember the pathway from the membrane to the pain. How NSAIDs stop the signals in the inflammatory chain. From ibuprofen to naproxen, they reversible stay, while aspirin the prostaglandins they send, and you'll master pharmacology right